Have you ever struggled with anemia, or you've just been curious to learn more about it? If so, you've come to the right spot because that is the topic for today. We are going to talk about the different types of anemia, what it is, what labs you might get run for workup for anemia, what foods you should consider, including if you are struggling with the two forms of anemia that we are going to talk about today, what to think about with supplements. And there's actually a symptom that I really want to point out in regards to iron supplementation that you should just be cautious about. If you have this, we'll talk about that later on in the video, so keep watching till towards the end. And then lastly, we will talk about just some other fun facts. So thank you for showing up. If you haven't yet, hit the subscribe button, hit the little bell next to the subscribe button, which will notify you when I post new videos, like this video, all that. I really am grateful for you for doing, because it helps push my videos up in organic search, which will allow me to continue to make these videos for you. So thank you so much, and now let's dive in. So let's start off by talking about what anemia is. Anemia is a condition where your body lacks enough red blood cells to carry oxygen to your tissues. There are different forms of anemia, and the two forms that we're going to talk about today are the most common ones, which are iron deficiency anemia and vitamin deficiency anemia. Having anemia might make you feel weak and tired. It might also be the reason for having heart palpitations, having shortness of breath, cold hands and feet, cold extremities, pale skin, pale tongue, hair loss, and even maybe brittle nails. So there are a lot of root causes. Functional medicine, we're all about root causes, right? So a lot of reasons that someone might get anemia. Some of the most common are maybe somebody's just not eating enough of these nutrients that we'll talk about in a bit, like iron, vitamin B12, folate from their food. So vegetarians and vegans are at higher risk for getting anemia. Also, somebody has digestive issues that might not be absorbing the nutrients from food properly. Celiac disease can be a reason for iron deficiency anemia, or things like SIBO, so small intestine bacteria overgrowth. Women, during their menstrual cycle, lose blood. Blood loss can be a reason for being at risk or getting anemia, and also pregnancy. So women who are pregnant have a higher risk and a higher need for iron, which we will talk about. Further, certain medications could put you at risk for getting nutrient deficiencies. If you're curious about this, I suggest you go to mytabin.com, type in your medications, and it'll pull resources that'll show what research we have connecting a possible medication with a nutrient deficiency. One set of medications that's very common are proton pump inhibitors. Now, don't stop your medication. These videos are not even nutrition advice, definitely not, medical medication advice, but I just want you to be aware of this so that if you're struggling with this, and you've been struggling with anemia for a while, it can be something that you present to your physician. Just ask your physician about. And that brings me to our next discussion, which is lab work. So what to ask for when you're concerned about anemia. Present your concerns to your physician, your provider, and they will probably run something called a CBC and an iron panel. What they're going to be looking at is your hemoglobin, and then something called the MCV, which if your hemoglobin's low, MCV high, it might indicate that you have a low vitamin B12 or folate level. If your MCV is normal or low and your hemoglobin is low, that would indicate iron deficiency, and work with your provider because they can look at the other labs and really kind of put together the picture for you. Now, I bring this up because as a dietitian, I want to make sure that you're getting the proper labs for checking nutrient levels like vitamin B12 and folate. And so a lot of times, just a serum of vitamin B12 will be checked, but this is not the most accurate. What you're going to want to check is methylmalonic acid, which is something that if we have enough B12, it breaks it down. So if we're checking methylmalonic acid and it's high, it means that our body does not have enough of that vitamin B12, indicating a low store, a deficiency that we should supplement and replace. The other lab is homocysteine. Homocysteine needs B12 and folate to break down. So if our homocysteine level is elevated, it means that, again, we don't have enough vitamin B12 and folate to break that down. And once again, I bring this up because checking a serum B12 is not the most accurate. So if you still have suspicions of having a low level of that, even though your lab is normal, your suspicion might be correct, and I would recommend asking for that methylmalonic acid level. So we talked about possible symptoms of iron deficiency. Possible symptoms of a B12 deficiency, vitamin B12, is everything from memory loss. It can actually cause permanent brain damage if left unintended. It can cause tingling in the extremities, again, hands, feet. As a digestive health dietitian, something that is really kind of at my forefront is thinking about these villi, these little ridges in our intestine that really help with absorption, food absorption. And having a B12 deficiency is going to not allow those to grow and be as healthy as they should to help with absorption. Something else I want to note for you about checking iron levels versus, just suspicion and supplementing is you do always want to get your iron checked, because some people don't regulate iron properly, and that can be very concerning if somebody is supplementing with iron, but they're one of those individuals who don't regulate it because they might be at risk then for iron toxicity, which nobody wants. Okay, so now for the fun part, food. Let's talk about vitamin B12 first. What foods contain vitamin B12? Well, it's mostly in animal products. So meat, some dairy, eggs, so poultry, fish, beef, bison. Choose grass-fed. It's going to be higher in those omega-3 healthy fats for you. I would say grass-fed beef, grass-fed bison are going to be great. There aren't a lot of non-meat forms of vitamin B12, but nutritional yeast is one of them, and there's some in fermented foods like kombucha. So you could use those. Some of the vegan products do have vitamin B12 fortified, so it means that the food manufacturer is adding it back. So you can think of like a supplement of B12 just being broken up and added to your food, such as happens with cereal. I am not recommending that you eat cereal. If you're wondering why, comment below, just say cereal. We can have that whole discussion, but I would say we want to try to get B12 from more natural food sources. So the yeast, if nutritional yeast, if somebody is vegan, and then of course those animal products, the organs, the grass-fed beef, the bison. So now let's talk about food sources of iron. I'm not sure if you know this, but there are two forms of iron. There's heme iron, there's non-heme iron. Heme iron gets absorbed in the body at 20 to 30%, non-heme iron at 5 to 12%. So as you can see, we want to try to choose food sources that are richer in this heme iron because it's more absorbed in the body. How much iron do we need? The dietary recommended intake is between 8 to 18 for most adults. So lower for men, higher for women. Pregnancy, it is 27 milligrams per day. So heme iron, that better absorbed iron, is found in animal products. So again, the clams, the oysters, the sardines, the beef, the bison. Non-heme iron is more so in the plant foods. So blackstrap molasses, cooked spinach, lentils, beans, tofu. If you do eat a lot of foods that are high in non-heme iron, what you can do is you can add some vitamin C foods to the non-heme iron foods to help with the absorption. Research shows that just 100 milligrams of vitamin C can increase absorption of that iron by 67%. So pretty significant. Some high vitamin C foods, I mean, you all probably know about oranges already. Red peppers are actually higher than oranges. And some more of those citrus foods, the tomatoes. So if you think about combining them, beans being high in non-heme iron, tomatoes being high in vitamin C, chili, right? So that would be a good combination to help aid in the absorption of that non-heme iron. So some foods can also inhibit, so prevent absorption of iron. So you're going to want to be careful to avoid having these foods when you have these iron-rich foods if you're really trying to replace your stores. Calcium can prevent absorption, so avoid taking any calcium supplements. Coffee and tea, because of the polyphenols in it, can prevent iron absorption. So hold off. If you're taking an iron supplement, if you need that, which we'll talk about in a bit, hold off on taking that with your morning coffee. Also phytic acid, which is found in grains and legumes and soy, which is interesting because I told you lentils are high in non-heme iron. Well, this phytic acid can further inhibit the absorption of that non-heme iron, which is already lower absorption than heme iron, right? So be cautious of that, and that's all the more reason that you're going to want to add a little punch with some high vitamin C foods. So the tomatoes again, the peppers, just do a Google search what foods are high in vitamin C, or if you want to try to be consistent, if you're traveling, you can always bring along a vitamin C rich, drink packet or just a chewable supplement. So, while we're on that topic, supplements, what to do, right? Well, first of all, as I kind of hinted at already, don't supplement until you have labs ran, because believe me, nobody wants to have high iron issues. So if you indeed are anemic, iron deficiency anemia, and your provider recommends a supplement to you, I want you to know that these supplements aren't always well tolerated. They can sometimes cause nausea, and the biggie is that they can make constipation worse. So if you're someone who struggles with constipation, you're going to want to be careful of this fact. And you're going to want to work with your provider, maybe even connect with a dietitian, like a functional nutrition dietitian, to work through why you might be struggling with that constipation, maybe even work to resolve that before you start on an iron supplement, or just combine something with that iron so that the constipation doesn't get worse. It's very, very important that we're having 1 to 3 bowel movements a day for a variety of reasons. Again, we can talk about it in the comments, or we can make another video, but the purpose of this is iron, and know that about iron. The one that is least constipating is going to be, and most tolerated, is iron glycinate. So if you're talking with your provider, maybe just bring that up, and you could also try to find a combination product of the iron with the vitamin C so that you're really kind of maximizing the absorption of that supplement of those nutrients. And B12 supplementation, just some things to be aware of. There are different forms of B12 on the market, and not everybody does well with certain forms of different B12. So again, check with your provider. Methylcobalamin is a very kind of common go-to. Cyanocobalamin might not be well absorbed by you, which can be a genetic predisposition, and sometimes it can give people a little bit of anxiety. So if this is happening to you, talk with a dietitian and just see if switching forms might be helpful, or again, rewind back to those food options and maybe try to get some more in through your diet. And of course, always look for what those root causes might be that might have put you in this place for having the deficiency in the first place. So now, a fun fact about iron deficiency. Have you ever had your hemoglobin A1C checked? A lot of people have. This is an indicator for the average blood sugars over the past 3 months. Well, you don't want it to be too high, because that could just mean that you either have prediabetes or you're going down that road to diabetes. Something to know is that if your hemoglobin A1C is elevated, it's high, but you really feel like, what you eat, your lifestyle routine, you shouldn't be having elevated blood sugars. Well, iron deficiency could be causing that to be falsely high. So by treating the iron deficiency, you might find that your hemoglobin A1C normalizes. So just a fun fact there for you. All right, so hopefully you've learned a lot of really fun information that you can now go out and impress all your friends with. I know this is something that probably everybody loves to talk about, so share it with the world. Just to review, we have a bunch of different types of anemia. The two we talked about today are iron deficiency anemia and vitamin deficiency anemia. So talking iron, vitamin B12, folate. We talked about some foods that are rich in those nutrients, and really a lot of it is those meat products, and especially organ products. So liver and other organs of the animal are going to be very rich in both iron and vitamin B12. So if you can find a way to incorporate those, that would be great. And then also vitamin C, which can aid and increase the absorption of the iron. Again, a study showing how just 100 milligrams increase absorption by 67%. So rewind the video if you want to hear everything again, but we have come to the end, and I thank you so much for watching. Subscribe if you want more videos like this. Hit the little bell, like this video, comment, and thank you. I hope you have a wonderful day.